Thank you. Good afternoon. I am very glad to be here with the honorable panelists. I would like to start with our country's situation first. As you may know, Laos, PDR, is a low-income country, which country's geography and is equally diverse, with highland in north and lowland in the south of Laos, comprising of Vientiane, capital, 17 provinces, 148 districts, and 8,507 villages. We are one of the lowest population density country in the world, and with considerable variation in level of poverty and health outcomes across geography and ethnicity. Our population of 6.5 million is comprised of 4 main ethno-linguistic groups and 49 officially recognized ethnicity, with as many as 120 distinct ethnicity. About 17.3% households in Laos are facing impoverishment due to health spending. In the context where Laos health strategy is clearly underpinned by our goal to achieve UAC, the country is responding to challenge of promoting health access and inclusion of ethnic minorities and geographical isolated communities through its various health insurance schemes, such as State Authority of Social Security, or SASS, Social Security Organization, or SSO, Community-Based Health Insurance, or CBSI, Health Equity Funds, or SEF, and Free Delivery and Treatment of Child under 5 years old, or Free MNCS. Now I would like to highlight the two schemes aimed at inclusive and universal access. They are Health Equity Funds and Free MNCS program. In 2004, Health Equity Fund was introduced and implemented with the aim to provide basic social and health protection for the poor to address inequality in access to health services in Laos. Health Equity Fund's benefits package typically include the outpatient and inpatient care services, as well as travel and food subsidized. The Free MNCS is a recent national policy granting supply-side provision of universal MNCS services free of charge, available nationwide except in the capital at a public facility regardless of formal coverage status. More recent progressive expansion of social and health protection to a whole population through a unified scheme with a vision of integrating the Health Equity Fund, Free MNCS program, and community-based voluntary program to reduce fragmentation in the system. Of course, we are face many challenges. Two, we are committed. The first is geographical location and accessibility of the poor and vulnerable population. The poor are often living in remote areas and are ethnic groups with diverse language. The second is the limitation of targeting. It's difficult to find and identify poor households and criteria for the poor between the poor and near poor. The third is poor definition awareness. Often people do not know their right to health care and do not access health care. The fourth is fragmentation of system. There are duplication of shame and support. The fifth is the country is currently facing donor transition as we enter to low middle-income country, which further strengthen our limited fiscal space, many health priority with limited government budget for health. In Laos, there is saying, our fund is like a blanket. If we cover the head, it will not cover the feet. If we cover the feet, it will not cover the head. So is that. However, we are committed to achieve universal health coverage by 2025 by expanding population and service coverage and improving financial protection for all, including the poor and the most vulnerable groups by establishing National Health Insurance Fund, which integrate 3 informal insurance schemes, just as the Health Equity Fund, Free MNCS, CBHI, together. And further on, we will also plan to include SASS and SSO under the unique National Health Insurance Bureau. Thank you.
Thank you very much, Dr. Phouthone.